it's CJ. Did you know that birth control pills not only decrease your risk of getting pregnant, but also offer a number of benefits that you may or may not be aware of? It can help with your menstrual cycle, making it shorter, lighter, less painful. It can also make it a lot more predictable. If you struggle with acne, menstrual migraines, PMS, PMDD, or endometriosis, birth control pills can also help with those symptoms. There are two different kinds of birth control pills out there, the most common of which is a combined contraceptive. It contains both estrogen as well as progesterone. The progesterone tells your ovaries to stay asleep, and it changes the pH of your cervical mucus, making it hostile to sperm. There are a number of different progesterones out there, so if you try one pill and it doesn't work for you, that's okay. It is very appropriate to give another pill a try. There are some people who cannot take estrogen. If you have a history of having a stroke or a heart attack, if you've had a deep vein thrombosis, a clot in your leg or your lungs, if you are breastfeeding or have a history of breast cancer, if you are over the age of 35 and are a smoker, or if you are taking medication such as anti-seizure medication, you are not a candidate for estrogen use. The good news is there is an option for you called a progesterone-only pill. These pills contain no estrogen, so are safe for everybody unless you've had breast cancer. You still can't take that pill. If you have decided that the pill is right for you, your provider will probably order a pregnancy test. They may recommend you start taking the pill on the first Sunday after your menstrual cycle, or they may just tell you to do a same-day start. Start the day you pick up your prescription. You're going to want to take one pill every single day. If you forget to take your pill, take it as soon as you remember it. If you forget to take your pill for an entire day, double up the next day, and make sure you use a condom for the next couple of days. Birth control pills are picky. They do want to be taken around the same time every single day, especially those progesterone-only pills. That doesn't mean you have to take it to the minute, but if you're going to take your pill in the morning, take it in the morning. If you're going to take it in the evening, take it in the evening. I do recommend condom backup for the first 5 days. Once you have started taking your birth control pills, there are going to be some side effects, especially for the first 3 months. Irregular bleeding is really common. It'll drive you crazy. My recommendation, just keep taking the pill as directed. By about the 3rd month, that breakthrough bleeding, that spotting should be just about done. You may have a little bit of nausea, probably will have some breast tenderness. Here are some symptoms, however, that you do not want to ignore. Birth control pills do increase your risk for blood clots, so if you have the worst headache of your life, changes in your vision, chest pain, abdominal pain, pain in one leg and not the other that is unexplained, if you have shortness of breath or chest pain, please go to the emergency room or contact your provider right away. So what questions do you have about the birth control pill? I hope you'll leave those in the comment section below. And while you're in that comment section, I would sure appreciate it if you'd hit that like button.
If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.